Thomas Rao is a conventionally schooled MD with additional training in homeopathy. He is medical director of the Paracelsus Clinic, a center for biological medicine. If someone were to say to you, what is biological medicine? What's the answer?
Biological medicine integrates different traditional methods. For example, it integrates the acupuncture, it integrates herbal medicine, homeopathy, which has its tradition in Europe. It's very much based on such factors which school medicine or orthodox medicine, as it's called, doesn't touch anyhow.
You've said that looking at a person's health, that what you can see is really just the tip of the iceberg. What do you mean by that?
When a patient comes to a doctor normally, this patient presents a symptom. For example, arthritis, swelling of the knees or whatever. And then it's only treated against the swelling. Nobody asks what is behind and below.
In other words, what caused it?
What caused it? But always there are several causes. So it's always a multi-level thing which create a malfunction which then makes the symptom.
So you treat the individual. You could have two people sitting in front of you who have arthritis or cancer, and maybe you would treat them very differently?
Totally differently, because we treat the patient and not the disease. That's the difference. We treat the constitution, we treat the way of his metabolic pathways, which are out of balance and therefore create a disease.
And one of the first things you do, if I understand it correctly, is try to detoxify them.
Yes.
How did we all get to be so toxic?
Because nearly everybody has toxic elements in their teeth, because all the prepared food has preservatives in. And what means preservatives? It's nothing else than suppressing metabolic functions. They prevent from bacteria. But inside you have billions of bacteria which you need to, and they are suppressed too. So your whole internal milieu is changed. And this has to be upbuilt first. We make a solid base to heal. We instruct the patients how to eat correctly and what to eat correctly. I found many patients who just came for checkup, and we found early signs of cancer which were healable with biological medicine.
When you have a patient who you can see has a tendency toward a disease as potentially life-threatening as cancer, what do you do about it?
Cancer is not having cancer or not. It's not black or white, healthy or cancer. There is a long development which lasts for years. And the sooner we see it, we can reverse it because we take away the causes. We never create fear. We always create hope. Each of us has cancer cells, but they are recognized by the immune system and they are eliminated. And if the immune system has so much to work with other things, then it has no more the strength to act against cancer cells.
You've also said that becoming and staying well requires a commitment to change, including in your mental attitude. What does your mental attitude have to do with it?
Spirit and body and mind are very densely connected. If you have a negative attitude to your organism or to universe or to the world, then the chance to get sick is much bigger. For example, just if I see a patient has cancer, if you say, oh, I have to send you to the specialist, I don't know what to do now. Isn't it different that if you hear, well, I know about this situation and there are methods to help you. I like to guide you through your disease, but you have to bring you in a positive way too. Isn't this totally different information and gives you strength to fight against your cancer? What we try to do is really to bring their forces of positiveness into their healing, because the healing comes from inside and not from the doctor. We can only lead.